Hello, my name is Pragya Chaudhary and I'm a member of Health Needs RX, an organization with a mission to mitigate health disparities through educational video content and information guides on essential topics such as chronic diseases, mental health, respiratory illnesses, health literacy, and more to help people optimize their health. We also strive to spur discussion on health disparities and the state of them today through our blog MedQuity and this very podcast discussing disparities. Today, I am joined by Dr. Hardeep Kataria, who will talk more about vision health. Thank you so much for joining us today.
Hi, thank you so much for having me.
So, my first question for you is, what are some of the biggest issues in vision health?
Okay, well, firstly, I am an optometrist. I practice in Los Angeles, California, and I am located primarily in a private practice. And where I practice does come with a lot of challenges. And so a lot of the experience that I have has come from working in the private practice setting. Having said that, I've also worked in a community health center where the focus has really been a significant amount on public health education and developing programs to really get down to the nitty-gritty of why we have such huge disparities in vision health. And so just to give you a little bit of background as to why I'm here and why I'm speaking about this today. So to answer your question, what are some of the biggest issues that we face in the United States and worldwide in vision health? And the biggest issues are blindness and visual impairment. And I mean, it comes down to people just cannot see well. So the CDC reported that in 2015, 1 million Americans were legally blind and 3 million Americans had a visual impairment. So legally blind, the definition in the United States is basically being able to see the big E on the letter chart when you go to the optometrist. And a visual impairment is essentially any inability to see, and sometimes considered as 4 lines away from perfect 20/20 vision. So that's a significant amount of Americans in just 6 years ago who were considered legally blind, 1 million. And upwards of 11 million Americans need vision correction in the form of eyeglasses or contact lenses. And unfortunately, by 2030, it's estimated that all of these numbers will double. And that means that 2 million Americans will be legally blind. And by 2050, unfortunately, these numbers are going to triple. So this is pretty scary. Blindness has significant impacts on a patient's individual life and the ability to function, ranging anywhere from being able to navigate around their house or eat their meals, or a very significantly debilitating activity is not being able to drive. So having your license taken away from you because of your vision can have devastating effects. And this really translates to then significant mental health complications. Somebody who is blind or visually impaired can easily become depressed and socially isolated. So when we consider, what are these factors that have led us down this path in our country? And the number one factor is age. And the fact is that the US population is aging. And with that comes disease of the eye that can result in legal blindness. And data in the United States show us that conditions leading to legal blindness will increase with age, and maybe certain diseases, women seem to be at slightly higher risk than men in suffering from these major eye diseases. And when I talk about these eye diseases, I'm referring to cataracts, glaucoma, diabetic retinopathy, and age-related macular degeneration. Going back to the question, what's another big issue in visual health? Well, it's socioeconomic status. So according to a study that was published in 2013, lower income individuals and those with less high school education were at the highest risk for detection of eye disease. And studies even dating back to prior to 1999 have demonstrated this consistently. So, it creates a burden on the healthcare system because adults who should be having their eyes examined for adult onset diseases such as macular degeneration and glaucoma, they're going undetected. And this is a huge burden on society because we have people who are unable to work in certain fields, and vision loss and blindness, again, can lead to mental health concerns such as depression, isolation. And the unfortunate thing about this is that eye diseases such as glaucoma, in most cases, are completely preventable. And and treatment is most successful with early detection. So socioeconomic status, age, I feel are the biggest issues out there. Additionally, we've got lack of awareness of the importance of visual health. It's more prolific in lower income, minority, and uninsured communities, and that leads to disease states that really could have been prevented. There's also an increasing trend amongst those who have had less than a high school education to actually afford eyeglasses. So that's another problem completely. So now, not only do we have a lack of access to care, but when there is access to an eye care provider, they are now unable to afford recommendations such as eyeglasses that are there to rehabilitate their vision. And lastly, another really big issue in vision health is I think there are many regional challenges, such as lack of transportation in some rural parts of the country. And lastly, cultural competency is a major player here. So cultural biases such as a lack of trust in doctors and a fear of medical facilities in certain communities. The healthcare community really needs education on how to check their own implicit biases, so to speak. And I think we have to start thinking about how to break the barriers in the communities. How do we educate patients to enlist their trust in us? And in some communities, it's gender related, right? I mean, men trust men, women trust women. And sometimes it's a question of comfort. Some women feel more comfortable with women doctors. And I think this all, falls under the general category of cultural competency. So big issues, age, socioeconomic status, education, lack of awareness, and then I think we've got some cultural competency that plays a role as well.
Those are really, really, really good points. I'm still 11 million people. That's like almost an unfathomable number, and the fact that number is going to double, and all of those disparities, talking about socioeconomic, not even being able to afford, cultural competency, all of those disparities that come into play, certainly things that people should keep in mind, people should be aware of.
Yes, definitely.
So talking a little bit more specific now, what vision health problems do kids face? And we'll be going up through the ages. So kids, teens, adults, and the elderly. So starting with kids, what vision health problems do kids usually face?
So the biggest visual health problem, I think we can lump kids and teens into one category. And the biggest issue with visual health in children and teens is that uncorrected refractive error that leads to permanently decreased vision if it's not treated by a certain age, and that age is early teens, which is why I grouped them together. So this condition is called amblyopia. So amblyopia is a refractive condition usually characterized by one eye or both eyes having a disadvantage because the restriction is really high in one or both eyes, or there is an eye turn, either the eye turns out or the eye turns in one or both eyes. And what happens is that the lack of clarity that's going into the back of the eye called the retina and then getting transmitted to the visual cortex in the brain, that lack of clarity does not allow that part of the visual cortex to develop properly, and that allows more focus on the other eye, and that poorer seeing eye ends up becoming suppressed. The vision is suppressed, and when the vision is suppressed and it doesn't develop properly, that's when that's when it results in a permanently decreased vision state. And so this is a big issue with children and teens, because if you don't detect this at an early age and implement appropriate treatment at an early age, then unfortunately the patient will have decreased vision for life, and there's nothing that can be done about it. And this kind of goes back to my first point that, we have to advocate for our patients, because in the end, this precludes certain populations from pursuing certain careers because of their vision. And this can have long-lasting mental health effects as well. So it all kind of ties in together. Children of young age and teenagers also face myopia, which is known as nearsightedness. So that means that you can see well near, but you cannot see well far away without glasses or contact lenses. And if this is severe and advanced enough, it can actually cause significant vision loss, and it can cause glaucoma and retinal detachments, or put you at risk for these conditions. And don't forget that these are secondary conditions that compound the vision impairment that myopia causes anyway. So children and so kids, I guess, children, teenagers are definitely at risk for permanently decreased vision with amblyopia, and then also progressive myopia, and that's definitely a huge concern. And then for adults and the elderly, they face the risk of adult onset conditions such as glaucoma and diabetic retinopathy and macular degeneration. And the reason I bring these up is because, and also cataracts, of course. And the reason I bring these up is because cataracts are the leading cause of blindness in the world and in the United States, and glaucoma is a close second in the United States. So when I think of risk factors for any disease process, I always split this into modifiable and non-modifiable risk factors, right? So if we look at the modifiable risk factors for macular degeneration, for example, these include high blood pressure, smoking, and UV exposure. And then the disparity exists when we look at the non-modifiable risk factors, such as our age, race, and then possibly sex. So research shows that older white women seem to be at a higher risk for macular degeneration, but the data might also represent women that are maybe just living longer. Either way, we've got age, we've got race, and these create a disparity. One study even reported that macular degeneration accounted for 54% of blindness among whites, as compared to only 4% in blacks and 14% in Hispanics. So already, when we look at the non-modifiable risk factors, race plays a huge player. It contributes a huge amount to the development of these issues, and it again just points to the fact that we need to be better about getting these patients in to detect them and then implement treatments to prevent permanent blindness.
Those are some really serious things that I hope that our listeners keep in mind for kids, as you spoke about amblyopia, progressive myopia, making sure that you are getting your eye exams, and then the modifiable and non-modifiable things for adults, making sure that you're taking care of all of your health, as that can have effect on your vision health. I know you talked about the diabetic
retinopathy and the high blood pressure, right?
Exactly. So making sure that you're taking care of all of your health and seeing how the rest of your health is affecting your vision health, and if so, vice versa. And I'm really glad that you brought those things up. And speaking of vision health problems, what are some vision health problems that often go overlooked?
Oh goodness, there are so many. So uncorrected, yes. So uncorrected refractive error is the easiest and by far the simplest problem that goes overlooked. So, oftentimes a primary care physician's office or a nurse's office, they'll provide a vision screening. And you might be familiar with this maybe as a child or an adolescent. I mean, I feel like we may have all gone through this at some point, where we go to a primary care doctor's office and we have to read the chart at the back of the door or in the hallway, right? And a lot of times when we're seeing this chart, it's not necessarily calibrated for the exact distance that we need it to be, and the lighting isn't necessarily correct. And the whole point basically being that it's being measured under suboptimal conditions. And when you go to an eye doctor's office, you are actually having eye tests under distinct calibration. And so that's lighting conditions, the distance that you're sitting away from the chart, things like that. These are all carefully calibrated. And unfortunately, the vision can actually come out quite different at your primary care doctor's office versus when it's measured at your very carefully calibrated eye doctor's office. And you might think, well, okay, what's the big deal? It's just a couple lines of vision, but it can be really important for children. And if there is even a small difference in the vision measurements, it could mean that a child is actually struggling with their vision and maybe interfering with their learning. And when you have an interference in learning, a lot of times when we're making these advanced or specialized education plans for children, vision is overlooked, and we might diagnose a child with a learning disorder when actually it's a vision problem, and it's just a simple matter of getting glasses. So oftentimes, in addition to this, children don't know how to prescribe, they don't have to describe what their problems are. Like, how does a 5-year-old tell you that their vision is blurry, or that they have double vision, or that the letters are jumping on the page? They can't articulate these problems to us. And this might lead parents and teachers to believe that the patient has a learning disorder or a cognitive disorder, when again, really it's just a vision disorder that requires a simple correction. So that's a vision problem completely going overlooked because it's just not being measured in the right environment. And I mean, I see this very often with my young patients. So this is definitely a huge concern in our children. And then in adults, one very common problem that is misdiagnosed or overlooked, as you say, is glaucoma. And so glaucoma is often missed because there are no symptoms. It's actually known as the silent thief of vision, because in the early and moderate stages, you have absolutely no idea what's happening in the back of your eyes and what's happening in your vision. And same with really early diabetic retinopathy and also early and moderate macular degeneration. They could be missed because you don't have any vision problems. People often think, oh, I see fine, I can drive fine, I can read fine, I have no problems, therefore my eyes must be fine. But that's actually a huge misconception. And then there are very scary things that can happen at the back of the eye that are asymptomatic to the patient. For example, like a nevus at the back of the eye that may be benign at one point and then it turns malignant into like a primary melanoma or a primary cancer of the eye. So yes, you can have a suspicious lesion at the back of the eye and you don't really know about it until you've had a dilated exam. Or you might have a suspicious lesion at the back of the eye, but you might then get systemic symptoms of your condition, like, for example, cancer. And a patient might also represent, for example, with retinal hemorrhages at the back of the eye that might be leading to a diagnosis of leukemia, which actually has happened personally to a patient of mine, and they had no symptoms coming in. So the key here to remember is that there are so many eye diseases that can go undetected simply because they have no symptoms. And that's where the importance of the yearly eye exam comes in. And often we underestimate our brain's ability. We underestimate the cortical ability to compensate for these small misgivings in our vision. So imagine you have a glaucoma patient and you might have, maybe you have a little loss of peripheral vision way out in the far periphery of your visual field, and it's not really bothering you, and you really barely even notice it, right? Well, that actually means that you have glaucoma, and your brain has the ability to fill in those missing parts of your vision. So even if you might notice it sometimes, you might not really pay so much attention because you have this unbelievable ability by your visual cortex to just go in and fill that information in. So this compensatory mechanism is not necessarily helpful in these situations, but in terms of being able to function, then yes, obviously it's very helpful because you're able to kind of ignore that missing part of your vision. So, I mean, overall, I think that it would be a huge misstep to not go to your eye doctor yearly because there are so many problems that can go overlooked and they can cause a lot of problems in the future.
Absolutely. A small anecdote of my own, talking about how kids have trouble articulating, how it might not come off. I remember in the 4th grade is when I first went for like this eye exam, like a regular eye exam, because I found one day I was sitting in class and I just could not see the board at all. It was completely blurry. I raised my hand and told the teacher, and she was like, oh, okay, just sit in the front. Went home, told my parents, and luckily they were able to take me to the eye doctor, and I got my glasses. And I struggle to think, what if it hadn't gone so smoothly? What if it was like, oh, you aren't seeing, maybe you should have washed your eyes, something where it got overlooked, or as you said, it got misdiagnosed as a cognitive disorder or learning disorder, something like that. And yes, stressing the importance of going to an eye exam yearly. I'm a big fan of neurology. I don't know if fan is supposed to be the right word, but it's the word that best describes it. I'm fascinated by neurology and our brain's capability to compute. We get so much input just all the time, constantly. Sensory input from touch, sight, hearing, smell, even taste, sound. And we process all of that data, and we're able to make so many inferences that stuff like eye problems, eye conditions might go undiagnosed, as you're talking about, because we just process that data. And I think it's fascinating, but in this case, also kind of dangerous.
Yeah, I honestly completely agree with you. And I love that anecdote that you shared, because it not only highlights, the importance of having that exam and, children not being able to articulate blurry vision, but also certain communities just having access. It was so easy for your parents to just make that appointment for you, right? But in a lot of areas in the country, we just don't have that adequate access to eye care providers, and so many of our communities are going completely underdiagnosed. And it makes me wonder somehow, we read all this data, and we read this data about, okay, well, we've got 11 million Americans, suffering from legal blindness. How underrepresented is that data? It does make me wonder, and how much do these gaps in our eye care in this country really affect kind of our children and their ability to develop appropriately, because we don't, again, have that access in a lot of communities. And I love the fact that you're completely fascinated with the cortex's ability to fill in that information and these compensatory mechanisms, because the eye is a part of the brain. And when you look at the back of the eye, you can actually see cranial nerve number 2, which is a part of the brain. And so I love how we're able to make these connections just even in this short conversation.
Absolutely. And going off of our brain's ability and just eye problems that might not get diagnosed, what are some of the consequences of the failure to diagnose eye cancer early?
Well, I think with consequences of detecting eye cancer, unfortunately, is mortality. Because if it's the primary cancer of the eye, then it acts as if there were a primary cancer anywhere else in the body, and death is the biggest concern if it metastasizes. And so, just like any primary cancer of any organ, it can met and it can seed into different organs and easily become a stage 4 cancer. And oftentimes, the eye is very small. I mean, it's a tiny, tiny organ. It's a tiny and mighty organ, right? And there's a lot of room for error when it comes to cancer in the eye. There's lots of tissues that are very well vascularized in the eye, where cancer can seed and grow and make its way into the rest of the body. And then, of course, so if we kind of, it can definitely be life-threatening. It can be sight-threatening. I work in a retina practice, and so I'm afforded the opportunity to see patients who have undergone, for example, plaque brachytherapy or radiation therapy for the eyes, right? And kind of what their consequences have been afterwards. And it ranges anywhere from, a couple lines away from 20/20 vision to not even affecting their vision, to a couple lines away from 20/20 vision to having no vision, no light perception at all. I mean, there's such a huge range. It can fall anywhere on the spectrum. And the unfortunate thing about having radiation right into the eye is also that, once you've had the radiation, just like you do anywhere else in the body, there is collateral damage to surrounding tissues. And you're never really free of that collateral damage to the rest of the tissues in the eye. And I'll give you an example of a patient who came into our office, and we had diagnosed her with a cancer of her choroid, which is the tissue underneath the retina, so it's at the back of the eye. And we sent her over to UCLA to a retina oncologist, and she was able to receive plaque brachytherapy, which is kind of like a radiation therapy to the eye. And she did really well for about, I want to say, a year and a half to 2 years. And she had lost about 2 or 3 lines of vision. She was doing really well. She was able to keep her driver's license. We were managing with an oncologist, and she was doing very well in terms of her systemic health. And, it hadn't metastasized, and it hadn't made it to her lymph nodes. And then she came in one day, and all of a sudden she had a significant decrease in her vision, to the point that she could barely see my hand moving in front of her face. And that was a really big deal for her. So she came in right away, and what I found at the back of the eye was a secondary consequence of the radiation that she had received for the primary cancer. So my point being that just like a cancer in the body, you're never really free of the concern or of the worry that now there's going to be a secondary complication. So if we kind of go in order, life-threatening is obviously the most worrying consequence. And then it could be sight-threatening, where you lose your vision. And then thirdly, you're never really free of that worry, because the effect of the radiation can also make you go blind. And so, again, having that exam and having that access in our communities in this country is imperative, because there are certain communities and certain populations that are more at risk of these primary cancers of the eye, and we have to be good about detecting them.
Absolutely. And yeah, you've brought up some really important things. Just not detecting it can spread, and just the secondary complications after you get that treated, how those just stick with you. Not specifically eye cancer, but I've had other family members with cancer, and definitely stuff that radiation therapy does, the impact it leaves, and then having that near and around your eye, all of the important things that are in your face and in your head, having all of that secondary impact, that's definitely something that could be very, very not healthy.
Exactly. It honestly can be so devastating, and I'm so sorry to hear that you have family members who are experiencing cancers, systemically in parts of their body. And it's a very, in terms of the eye, it can definitely be devastating, and also, you kind of, like with other cancers, you kind of, lose that hope. And this patient, she had significant mental health implications afterwards, because it was just so difficult for her to accept that she had made it through the primary cancer, but then had just a lot of difficulty dealing with the consequences of the radiation.
And absolutely, that can have devastating mental health consequences, because you go through what is honestly not just a physically traumatic, but a mentally traumatic experience of being diagnosed and going through the therapy for cancer, and then having to live with the consequences of that therapy, the side effects that just you have to live with now, that make life harder, and that can definitely weigh heavily on your mental health.
Absolutely, you definitely hit the nail on the head.
And going further on vision health and optic disorders, what is some misinformations about vision health disorder?
I think really the most significantly, undoubtedly, is the fact that, the idea rather, that if a person can quote like see fine, that they feel that they have no problems. And a lot of, I see fine is relative. It depends on the patient's activities of daily living, right? So what do they do all day? Somebody who drives versus, somebody who sees patients all day like myself, or maybe somebody who works on a computer all day, and they have no problems with their, quote, activities of daily living, then they assume that their eyes are healthy. And I think this is the absolute biggest misinformation about visual health. And it can be a very dangerous one. It just goes back to the conversation that we've just had, because so many of these silent diseases of the eye will go then undetected, and they result in irreversible vision loss. So they present to the doctor, and a lot of patients will say, well, is there anything I can do about my glaucoma? I had no symptoms. And it's a difficult position for the eye care provider to be in, because unfortunately there's nothing I can do to reverse that vision loss. And, with glaucoma, for example, there's really no symptoms until the vision is affected centrally. And if the vision is affected centrally, in most cases, it means that they've lost most of their vision peripherally. And permanent. And don't forget that in many cases, it's actually preventable. And so definitely, undetected silent thieves of vision are a big issue. Another misinformation is about traumatic brain injury. So, for example, the American Optometric Association states that 90% of the TBIs will present with at least one ocular finding, given that 50% of the brain surface is involved in visual processing. So, what does that mean? I mean, there's a significant, population out there suffering from TBIs, especially, for example, our very famous football players in this country. And football is beloved to us in this country. And these patients who are suffering from TBIs, will have one ocular finding that will stay with them unless it's treated. And so, again, just because you're not having any problems doesn't mean there are no problems.
Absolutely. And these are some important things to keep in mind. With traumatic brain injuries and their connection to optic problems, optic health problems, and these silent killers, there definitely is a need for better education on optic health, problems with optic health when you are losing that peripheral vision. If you even notice it, maybe going and checking on it, making sure you're getting those regular eye exams, making sure if you have a traumatic brain injury to check up and check in with your eyes and make sure that they're working. And those are important things to keep in mind. And
Yes.
How accessible would you say vision healthcare is?
Well, this is a really difficult. I think it's a challenge. I think it's very challenging because I don't think that vision healthcare is very accessible at all. And I think as a healthcare community, we really need to identify barriers to vision care within our healthcare system. And it's been reported that accessibility of care, continuity of care, regular resources, physician advice, these are all factors that are associated with patients not seeking vision care. And, so it comes down to not only patient education, but education within the healthcare community. And so I'm going to talk about why I say that. Okay, so we've got an estimated 93 million adults in the United States who are at high risk for a serious vision loss, but only half of them have visited their eye doctor within the past 1 year. Okay, 50% of people are getting eye exams. And I think that health insurance plays a big role in this. Okay, so in 2020, there were 31 million Americans without health insurance. So studies show that people without health insurance are twice as likely to not even have their eyes examined yearly as compared to those who have insurance. And those without insurance in the US were more likely to be under the age of 65 because obviously Medicare is available to those over 65. And then also those without insurance were more likely to be Hispanic and African American, have a lower income and lower education level. So just a little bit of background as to why vision insurance and health insurance plays a primary role is that vision insurance works very differently in the eye care world because there are two types of insurances when it comes to having your eyes checked. It's a vision insurance, which typically allows for a basic eye exam, and then they put a certain fee towards your glasses and your contact lenses. And then you've got medical insurance, which allows for medical treatments such as your eye diseases like glaucoma and cataracts and things like that. So imagine if a patient doesn't carry vision insurance, there can be a lot of out-of-pocket costs that are associated with the purchase of eyeglasses and contact lenses. And so a more streamlined and unified insurance system would be more ideal in helping these populations and communities get even access to eyeglasses and contact lenses. And it was interesting because there was actually a study that was published in the Journal of Ophthalmology in 2017, and they looked at whether the insurance affected a patient's ability to access testing for glaucoma. And the investigators found that the patients who had Medicaid insurance were disproportionately receiving less glaucoma testing than those with commercial insurance. And despite this finding being consistent across all insurances, they actually broke it down further by race. And they found that African Americans with Medicaid were receiving the least glaucoma care. And you know what's so surprising about this study is that glaucoma tends to cause blindness in African American populations more than any race and ethnicity. So the fact that insurance plays such a big role in the access to care is disappointing, because it's almost like it's closing the window of opportunity for these really high risk populations to even have access to the care in the very beginning. And so, the disparity exists based on race, based on insurance, and then likely a combination of both. And so I think that's number one, is the insurance, the type of insurance is causing a challenge in the accessibility of vision care. And then the second thing is that we really need primary care physicians to send every single patient to their optometrist or their eye doctor. And this is whether the patient is having difficulty with their activities of daily living or not. And why do I say that? Well, there is always a reason. It's just a matter of educating the primary care physician, right? There's always a reason to get your eyes checked, whether you have a history of glaucoma, a family history of glaucoma, family history of diabetes, family history of macular degeneration, you're of the age of having a cataract because you're 65 years old. There's always a reason that a primary care doctor should be sending those patients to an optometrist. And also many disease states that are systemic, like high blood pressure, they have ocular manifestations. High blood pressure in the body affects the vessels in the eye. And the optometrist looks at that when they do their dilated exam. And then medications like hydroxychloroquine, they have ocular side effects and they need to be managed with an eye doctor. And so that's another big issue, is education amongst the healthcare community. And then in rural areas, especially, I feel like, there's an issue with accessibility to vision and eye care. And I think it comes down to public healthcare initiatives to really integrate optometry into the primary care sector so that we can be seeing more patients. And then also we have to consider like health literacy, right? So like how understandable, how simplified is the education that I'm putting out there to my patients as an optometrist? Not only how understandable it is, how simple it is to understand, and also how accessible is it to them. And it just I think it really just comes down to more collaboration between primary care and optometry. But I think those are the biggest issues: the insurance, and then really integrating optometry into primary healthcare.
Absolutely. And I mean, knowing that, I was not aware that African American communities are the highest risk of getting blindness from glaucoma, and then to find out that they are the people who are treated the least, like examined for it the least. That's disappointing, as you said, and honestly terrifying.
I completely agree. It's terrifying because these are the folks who are going blind, and this blindness is preventable. For the most part, it's preventable.
For the most part, it's preventable. It's just not being detected. It's not being prevented out of no fault of their own, out of the fault of the system. And I love how you bring up how we need to educate both sides. We need to educate patients on what they should be going for, what they should be looking for, what they should be talking to their eye doctor and their regular doctor for. And physicians and healthcare workers have to educate themselves, make sure that they're culturally competent, make sure that they understand the disparities in the system, and work to potentially better those disparities in their communities, as much as they can. And so we were talking about how glaucoma is more dangerous, I don't know if it is the right word, but dangerous in African American communities. What are some vision health problems that are more prevalent in certain groups of people than others?
Well, so yes, you hit the nail on the head with glaucoma in the African American communities, and then age-related macular degeneration, it's more likely in the elderly population. So, for example, starting, I would say, 65 and older. And then you've got diabetic retinopathy, which is basically when a patient has diabetes in their body and then they start having bleeding at the back of the eye in the retina. And so that's called diabetic retinopathy. That affects ages anywhere from 20 to 74. And unfortunately, diabetes is being diagnosed in much younger population than it used to be decades ago. And there are reports out there that say that this is the leading cause of new blindness cases in the country. And so again, 90% of blindness from diabetes is actually preventable, and it's linked to two major things. It's linked to blood glucose control, obviously, and then also having early eye exams, because when you do detect that there is diabetes at the back of the eye and it's kind of out of control, then you can actually enlist the patient or enlist the support of the primary care provider, whoever is managing the patient's glucose, to really get tighter control on the glucose level. And we have studies that go back to decades ago, back to early research in diabetes, where it showed that, well, if diabetes is affecting the eye, those are the smallest blood vessels in the body. And that means that diabetes is also affecting the nerves, and it manifests as neuropathy, and it's also affecting the kidneys, and that manifests as nephropathy. And so you've got neuropathy, nephropathy, and retinopathy that kind of all go together. And when you've got diabetes affecting the level at the small blood vessel level so much, you then also know that the diabetes is essentially out of control and it's infiltrating the body at a lot deeper level than you realize. So when you do an eye exam and you see that you've got diabetic retinopathy at the back of the eye, this is a pretty serious thing, and it needs to be communicated back to the primary care doctor or the endocrinologist or whoever is managing the patient's diabetes. And so diabetes is a big issue. And then you've also got, the duration of the disease. And so with type 2 diabetes, we know that the time of diagnosis is not necessarily the amount of time that the patient has had diabetes. And we might even have years of high blood glucose in the body and years of damage at the level of the eye, at the level of the kidneys, at the level of the nerves, and the patient really had no idea that they had this. And so diabetes, in short, affects a very large range in terms of age and in terms of different races. And it's an area that in terms of public health education, it needs a lot of work. And then if we break it down even further, where we look at race, we see that in the United States, that the studies are showing more and more that non-white Americans are at a higher risk for developing diabetic retinopathy, especially in the Hispanic and the African American population. And not only is it more prevalent, but when the disease occurs in these populations, it's actually more severe. So, I don't know, maybe this is related to diet, genetics, lack of diagnosis, lack of access to care. It's probably a combination of all of them. And then, don't forget, ocular diseases are not mutually exclusive. You can have more than one thing. So, a patient in my clinic typically has cataracts, glaucoma, and diabetes at the back of their eye. And this significantly multiplies their risk for blindness. Because, for example, a patient who has diabetes has a twice as high risk of developing glaucoma. So, and then you've got patients with diabetes who also have an increased risk of cataract formation at an earlier age than they would as if it was just from age. So, the vision problems that are more prevalent in certain groups, I think that, it's a multifactorial issue, because not only have I talked about race here, but I've also talked about, the different levels of access and, genetics and diet. And so I think that there's definitely a lot of factors that play in.
Absolutely. And I hope our listeners, if they belong to those groups that you were talking about, and the different vision health problems that they would face, I hope they keep in mind. Maybe that's something they need to look into. Maybe that's something they need to notice. Maybe that's something they need to talk about when they go, if they can go for an eye exam, if they can go to the doctor and ask to see if they can recommend an eye exam. So these are definitely things to keep in mind.
Yeah, I hope so. I hope that, doing outreach and, programs such as yours, reaches populations, or at least educates other healthcare providers to reach out to their patients and their populations and really encourage them to incorporate eye care into their systemic healthcare, because I think it's underrated and underappreciated. And a lot of that just goes back to just a simple lack of education, a lack of understanding, and a lack of incorporating, like I said, eye care into primary care, right? Eye care should be involved in primary care because it's an organ that we depend on a lot, and we can't live without it.
Absolutely. And talking about understanding eye care and understanding vision health, what are things that healthcare providers should keep in mind while treating vision health?
Well, I think that's a really great question, because it really kind of piggybacks onto what we were just talking about by incorporating eye care into primary care. I think first we have to adopt a different type of mentality in the public health sector, because we typically don't really consider eye care as a part of primary care. And I think that the biggest thing is that optometry, as the primary eye care provider, needs to become a significant element in primary care. Like I mentioned before, I think that any healthcare provider in a primary care setting, so physician's assistant or a group of nurse practitioners, and our primary care providers, our physicians, should really be sending every patient in for an eye exam to an optometrist. And so all of these non-healthcare professionals, I think this is the biggest thing to keep in mind. And then for eye care professionals, I think it just comes down to early detection and education. For example, let's say that you have a patient and they have some risk factors and you think that they might be a suspect for glaucoma. Well, in that situation, if that were me and I were the eye care professional, I would recommend that the patient see me sooner than their yearly eye exam. And what this demonstrates to the patient is that they have a serious diagnosis that has not yet led to vision loss, but if we leave it completely untreated and undetected and unmonitored, so to speak, then it can result in serious preventable but permanent blindness or vision loss. And I think that if we can all, as a team of healthcare providers, get on board with a lot of these preventable conditions in terms of, preventing blindness, I think we can reach a lot of patients. I think if the patient is hearing it from me, they're hearing it from their NP, they're hearing it from their PA, they're hearing it from their PCP. I think it becomes a lot more ingrained in the patient's ability to understand versus coming to me once or twice a year and me just having this, barrage of questions and information that might not necessarily stick, right? I feel like we do a really good job of educating patients about diabetes. Everybody knows what diabetes is. Whether you are an a primary care provider or not, you know what diabetes is. But I cannot say the same thing for glaucoma. I think people have heard the name, they know what the word is, but they don't necessarily know how it can affect the eyes and the fact that it can lead to blindness. I hope that makes sense, but I think it's a matter of education on both sides, like you mentioned earlier, not only on the patient side of things, but also in the healthcare community as well.
Absolutely. And talking about how people sometimes don't understand what glaucoma is. I honestly believe, I know what glaucoma is, but as I said, I'm fascinated by neuroscience. I study neuroscience, study health disorders related to the eye and the senses and neurology and the nerves. So I know glaucoma, but the average person may not, so they might not know what's going on, and making sure that healthcare providers are aware of that, that dearth, maybe being proactive and talking about, hey, this might be going on, hey, you might want to look into this, especially when you are going into those eye exams, or when you're just going to your primary care provider, and something that you want to keep in mind, like with somebody with diabetes, maybe the primary care provider wants to talk about how that might be affecting their eye health.
Exactly. Yeah, I definitely think. I think especially with a lot of our public health initiatives, I think a lot of it comes down to, number one, integrating, almost unifying the healthcare community, and also educating both sides. And then you can kind of go a step further and you can say, well, they can come together to educate.
Absolutely. And talking about people educating themselves, what should a person keep in mind while looking for vision healthcare?
I think the biggest thing is that it's the importance of just at a minimum a yearly exam, even if they see fine. Like we talked about, I see fine as a relative phrase, right? And also just to not skip the dilated exam. So just a reminder to our listeners, the dilated exam is when the doctor puts the eye drops in the eyes and then your vision is a little bit blurry for, maybe 4 hours after the exam. And I mean, yes, like it's very annoying to not be able to see for 4 hours in a day, but I mean, if we can spare time to spend hours in front of Netflix, I'm sure we can dedicate a couple of hours to an eye exam once a year. And really, that's just the biggest thing that I would say is don't skip it. Even if you feel like you see fine, you might not in a few years, unfortunately, and you really want to protect the gift of sight.
Absolutely. And I love that you said the gift of sight, because sight is such a gift. Just talking about how people find it annoying to not be able to see for 4 hours after a dilated eye exam. That's one time where you realize that how much you need to see. It's annoying when you can't see. So you really,
exactly.
you really want to protect that. And yeah, stressing the dilated eye exams and stuff like that. Yes, it can be an inconvenience, especially for 4 hours. You can't do things that you see. You might need to get yourself a ride away from the eye doctors. Figure that out. That stuff can be annoying, but as you're saying, Dr. Kataria, and I hope our listeners hear and internalize this, you really want to protect your eyes, and you really want to protect your vision health, because that's one of the most key, almost most taken for granted things we have. As you said, Dr. Kataria, like a significant percentage of our brain function is dedicated to vision processing. We do so much of that without even knowing that we are doing it. And then once you start losing that, it's so key. Vision is so key that once you lose it, it can shatter your life.
Exactly. It can be very devastating. And the key is that there are so many conditions that are preventable. It's just a matter of detecting and accessing those populations that are at risk and really spreading the word.
Absolutely. So as we close out our conversation, and I've absolutely loved our conversation, we've talked about so many important things to keep in mind, so much things that people don't understand, people should educate themselves about, things people should look into. Is there anything you'd like to add to our conversation?
I have had a great time talking about these different things related to eye care and primary care, and I just reiterate, what I said before about, just because you see fine, you might not in a few years, and getting that eye exam is important. And just thank you so much for inviting me to this conversation. I've really had a lot of fun in talking about the different topics that we've covered. And always just feel free to reach out if you ever have any questions about this. But I really enjoyed our conversation. Thank you so much.
And thank you so much for being here. You said earlier in this conversation that outreach and education is incredibly important, and your role in this is absolutely vital and key. Your information has been incredibly pertinent, incredibly helpful. I hope all of our listeners can take away from this as much as I have taken away from this one conversation, as much I have to think about, to talk about with my eye doctor next time I go.
Awesome.
And I found this conversation very enriching. I hope our listeners found this conversation as enriching as I have. And I'd love to I can't thank you enough for how you're helping in outreach and education. So,
Thank you.
my name is Pragya Chaudhary. I am here with Dr. Hardeep Kataria. We are Health Needs RX. Thank you for listening.